But just to give you an overarching view kind of the what I call kind of the pillars of what we do. Of course, there are a lot of things that we do here in our lab with our company, but what we've landed on right now is the primary thing that we're offering through the pharmacy channel is what we believe is a pretty unique diagnostic test for a number of very topical and common upper respiratory viral pathogens. And we were very intentional in landing on these three, it's actually four, of COVID, Flu-A, Flu-B, and RSV. COVID, of course, isn't going anywhere. It's still around. Hopefully we won't get, we will never reach that pandemic phase of it again, but it's here endemically. Flu-A specifically, B is not so much, but Flu-A is back with a vengeance this year, as is RSV, which traditionally was something that really only pediatricians were concerned about because it could affect infants, but there's certainly some information out there that it has spread and it's also affecting other portions of the population. And so knowing that these were kind of running rampant, we landed on these four pathogens as something that we wanted to test for, that maybe folks would struggle to access otherwise. We wanted it to be also in the form of what's called a multiplex, which is one patient sample can yield more than one result. And so again, middle to late last year, we developed this assay that we're using. It's PCR based, so it provides a robust set of data. A lot of information around, what your status is of these 3 or 4 pathogens, all of which present fairly similarly medically. The symptoms for them are very, very similar, but we can get results. We can get much more accurate results out of the type of testing that we're doing for them than maybe the quote unquote traditional manners of testing that are out there, specifically rapid and antigen tests. There are other places that will conduct these multiplex tests. More often than not, though, as opposed to being a 3 or 4 pathogen test, when you go to some of these larger commercial labs or hospitals or things like that, they're going to test for panels of viruses or just disease in general that might test for 18 or 25 or more of these markers or pathogens. And while that's all great information, not a lot of it is actionable because most of us have never heard of the things that they're testing for. But also from an insurance standpoint, no insurance company is going to cover the cost of a test that's that expansive. And so ultimately, the difference between what they're willing to pay and what is actually being charged is going to be passed along to the patient. So they're paying a lot of money for a lot of information that they don't necessarily need. I'll get into how we handle, well, I guess I can do it now. We do handle all insurance billing. That includes private insurance or commercial insurance, Medicaid of Georgia, Medicare. And because we have a good feel now for what the reimbursement typically is from these insurers for what we're doing, and we're comfortable with it, we will not pass along any balance billing or copays or anything like that to a patient. So when we submit an insurance claim, and I'll get to what goes into that, when we submit a claim, we basically take what we're paid. Of course, we will negotiate with the carrier if we are not in network, but at the end of the day, whatever that amount is that we are reimbursed, that's what we take. And again, we don't pass it along to the customer. So as long as the patient qualifies for that insurance coverage, and like I said, I'll get to that, this can be promoted to them or passed along to them as a completely free of charge test, again, which gets them a pretty healthy amount of information that they can use in conjunction with you and any other providers, their doctors, et cetera, to, one, see what's going on, and two, come up with the appropriate treatment protocol. So one of the things that we really hang our hat on, and I think has really attracted folks that maybe had been working with other laboratories in the past to us, is our turnaround time. We really do take it to heart that every sample we receive, not to overstate it that it can be life and death, but it's very important to the patient, to their family members, to their providers, that we get information back to that patient as quickly as possible. So again, time is, not only is time money, but time is, when you're talking about something like a virus, the longer it takes to figure out what's going on, the worse off the patient's going to be. And so everything that we receive, we turn around within 24 hours, but that's kind of what we put down on paper. The reality is that every sample that comes into this place, and we receive them all by UPS next day air. So they arrive typically at about 10:30 a.m. Eastern time every day, Monday through Saturday. We will get results out by about 2 o'clock that afternoon. So that 24-hour time frame or turnaround time really is, for the most part, is from the time that the sample was collected by the patient, which is pretty quick, again, when you consider the quality of the information that's coming back and the distance and things like that these samples are traveling. The only time that we don't tend to get results out by that mid-afternoon, 2-3 o'clock period is if a patient's sample has to be rerun. That happens on a rare occasion where we'll get an invalid result and we'll have to do a little bit of manipulation. But at the end of the day, very, very rarely are we not able to get a result. And even when that happens, it might only add an hour or so to that turnaround time. So again, something we hang our hat on, something we're very proud of, and something we are always focused on sticking to. So the other things that we do, they're still in a lot of states, we are required to, because COVID is involved, we are required to report the result of every test. Of course, it's de-identified, but we're required to report the results to the state or whatever entity each state has established for that reporting. And so we do that on a batch basis every night. For folks that, I don't know if you have, but for folks that have done their own testing with like tabletop PCR units and things like that, a lot of times that's the reason that they got out of it, is because it is quite a hassle to go through that process, but we've automated it on our end. The question always comes up around if folks don't have insurance or they don't qualify for insurance coverage, what can they do? We do offer a cash pay of price of $99 for this test, which again, we think is pretty competitive compared to what else is out there. Hopefully that, not a lot of people are going to use that, but if they do, if they need to, it's there. So as far as what I kind of want to go over here in the next, little bit is overarchingly is what I really feel like this program offers you is an opportunity to hopefully significantly, realize a significant source of new revenue if you haven't been doing testing previously. And just as importantly, some enhanced patient care that we hope is going to tie that patient to you even more closely than maybe they are today. But if I told you that you had to spend an inordinate amount of time and hire a bunch of people and all that kind of stuff to incorporate this program, the money that we would pass along to you would pale in comparison to the cost, and there really wouldn't be any ROI. And so everything that we've done, how we've developed this program, again, has been largely in collaboration with those two friends here locally, where we really looked at things through the lens of the pharmacy owner, the pharmacist, and their staff, so that what we're doing is as minimally disruptive to your day-to-day workflow as possible. We realize that your primary focus is and needs to be on patient care and dispensing good information and obviously dispensing medications and things like that. And so we don't want this to be a big distraction. We want it to be a service you provide that's largely hands-off for you and your staff. And then, of course, just it's worth noting there's no cost to you. So if it's something that you're interested in giving a shot, kind of kicking the tires to see if it works, I would highly encourage you to do so, because there really is not a downside in terms of monetary costs to getting involved in this. There's the potential for a lot of upside, monetary and otherwise, but it's not something that we ask anything of you in terms of cost. So I talked about new revenue and enhanced patient care. I'll start with the enhanced patient care as we see it. Of course, we're right in the middle of cold and flu season. I mentioned before that symptoms for all these things overlap, and that getting people a good, accurate diagnosis as early as possible is key. The other reality, though, I really feel like, and this is where this enhanced care opportunity comes into play, is that I don't know if it's like this around you, but it certainly is around me and many, many others that I've talked to, really literally around the country. is that our healthcare system is absolutely overloaded right now. There are, hours and hour wait times at ERs and urgent cares. There are, I know specifically around me, there are primary care providers that are actually not seeing sick patients. They're basically triaging them over the phone. And if they don't feel like they're in an emergent situation, they're telling them to stay at home, stay hydrated, take some Tylenol, call me, tomorrow or the next day if you're still feeling bad, and we'll reassess things at that point. I believe that's absolutely horrible patient care, but it's the reality that some of these folks are facing because there's just so many sick people out there right now. And so really where we see the value of the independent pharmacy is some of the things that are standing in the way of people getting this kind of care when they can't go to their doctor necessarily, or even when they can, is if you're not feeling well, you don't necessarily have to make an appointment to go to your pharmacy to have a sample collected and tested. You also, maybe just as importantly, you don't need to worry about, and this happens, right? There are people that don't go to the doctor, they don't go to the urgent care because they can't afford it, or they just don't want to make that copay, pay $100 to go into that urgent care, really just for the privilege of walking through the door. That's really what happens there. And so providing an outlet for these people that they can utilize that doesn't require these things, nothing out of pocket and not necessarily an appointment, but also gets them interfacing with the person or the people that ultimately they're going to be collaborating with anyway on their care, is a great thing. And so we really feel like that's something that you guys can offer your patients, both existing and new ones, that not a lot of other folks out there can. And then once those folks are in the door, this does represent, a new revenue source for you. When we submit an insurance claim to a carrier, whether it's private or government or whatever, we submit more than one CPT code. One of the codes that we will bill for is for the test itself. And that's how we make our money. We rely on volume clearly to kind of pay our bills, but that's what our revenue source is for this particular test. In addition to that CPT code, we submit another one that is specific to nasal swab sample collection. The Medicare reimbursement rate, which we consider to be the lowest common denominator the Medicare reimbursement rate for that is $23 and change. And so because you guys as the pharmacy are acting as the vehicle for that sample collection, we pass along $20 of that reimbursement to you, or of that claim to you in the form of a reimbursement on a monthly basis. So it's $20 for every sample. We're very intentional on that $20 amount as well. By staying at or below that Medicare reimbursement rate, we are not at any risk or in any, in a situation where we could be accused of offering incentives or kickbacks or anything like that. And so, of course, we want to stay completely above board in everything that we do. And so by staying below that Medicare rate, we're not in any danger of violating the law. And then the difference between that 23 and change and the $20 that we reimburse you basically helps us cover the costs of things like our collection kits and shipping and other stuff like that. And then the other thing that I personally really like about this scenario is when that patient is coming to you and they're being tested for things like COVID and flu, if they're positive for those, there's an actionable step that you as the pharmacy can take to provide enhanced care. So if you weren't seeing that patient before necessarily because they were going to their doctor, who is going to send them to an urgent care or a commercial lab, let's call it, to get a test, now that patient is kind of free to go wherever they want to get that script filled. Not that they're not in general anyway, but if they're coming to you, they're getting their result through their relationship with you. The chances of you getting that follow-up treatment, prescription, or whatever other protocol there might be is extremely high. And so it's an opportunity to, one, generate more revenue from people that are already in there, but also hopefully use this to attract new patients that you can also kind of open up to why you're better than where they might be going otherwise. So that's kind of in a nutshell what I anyway, I think there are others probably, but what I kind of view as the primary benefits of doing this. But again, we can't have it be so, the responsibilities be so onerous on your part that it doesn't make the juice worth that squeeze. So There are a few key responsibilities. They are largely oversight responsibilities that we ask of you, but let me go over what those are. Just before I start, just to put them in three buckets. One is assistance with collecting patient information. We've got a few things that we can do there. We of course need your help in providing a sample collection kit and some level of instruction to the patient on how they're going to collect their own nasal sample. In conjunction with that is a quick verification that they've followed the steps that we've asked them to follow when they turn that sample into you. And then the third is just going through the motions, essentially, of getting samples packaged in a box, to send us via UPS. So let me go with the first one of those. Go into the first one of those first. Patient information collection. That always, anytime you're talking about collecting personal and medical information from someone, that has the potential to be the most time-consuming part of any process. We've all been in that waiting room with a clipboard filling out the endless forms. They take a while. They're inconvenient. They're awful. We want to encourage as many patients as possible not to do that. However, I will start at the bottom of this list first. We do have a paper requisition form that patients or somebody on their behalf can fill out. I call that the if the internet breaks option. So if you're not able to take advantage of one of our electronic or digital options, that option exists. I would say less than 5% of the samples we receive come with a paper requisition form because we have two other options available. One is a patient registration portal. One is a provider-facing portal. Let me show you. This is probably the easiest way to. Now, you know what? We're going to run short on time, so I'll just explain it. We have a patient registration portal. When you enroll with us, we provide each pharmacy that partners with us a location-specific URL or web page, and a corresponding QR code that links your patients to our patient portal, or patient registration site or app or whatever you want to call it. It has a built-in access code that when we receive a sample or a registration from that patient, automatically tells us that they quote unquote belong to you. That tells us, one, who we're going to share their private health information with, right? It also tells us who we're going to pay that $20 collection fee to. It also tells us who the ordering provider is on the test. It's one of your pharmacists. So a patient who walks in, most pharmacies will post that QR code document somewhere and have the patient scan that with their phone. They can sit down somewhere in their car, off to the side, most importantly, not in front of you, coughing all over you, taking space up in the line with other patients. They can do this at their own leisure. It asks them for very basic information about themselves, about their insurance, and they can get themselves registered as patients in our system. They then can use this same app once they have entered their personal information into it. They can use it to take the actual collection kit that you hand them and register that sample. And that's a very easy process. It involves another QR code label that's on the collection tube itself, that the patient will store their sample in, that they register, and they're also asked for things like their symptoms that they're experiencing or potential exposures that to people that have tested positive. So very easy, very intuitive for them to use. Gets us all the information we need, and we really don't need any involvement from your perspective besides providing them access through that QR code, or even ahead of time using the web link that we send you. Some pharmacies will put that on their websites or social media or somewhere so that folks can get themselves registered before they even walk into the store. Recognizing, though, that not everybody has a cell phone or is tech savvy or is even willing or trustful of things like this, we do have something else that we call our provider portal. And so again, when you enroll with us, we will give you login credentials to this portal that we have that basically is something that you can use as kind of a dashboard to show you exactly what's going on with any and all samples that you have sent to us. So you basically have a live look on what's going on with, whatever patient's samples. So if for whatever reason they contact you and say, hey, what's going on with my sample? I, I submitted it yesterday. It's 12 o'clock. I haven't seen a result. You're able to go in there, see exactly what's going on. You can see that it's been received by the lab. You can see that it's in process with testing, and ultimately you can tell them when a result is available. That same portal can be used to register patients and again their samples on the patient's behalf if you so choose. So you can work with a patient that maybe isn't willing or able to use that patient-facing portal to enter their information directly into our system. Again, if that doesn't work for your workflow, those patients can also use that paper requisition form to register. Before I go on, so I mentioned how we issue results and that we populate them into that provider portal. I think I cover this later, but just in case, we don't only share results with you, we also send them directly to the patient. So in that registration process, if the patient provides us with an email address and or a cell phone number, as soon as a sample result gets posted to your provider portal at the exact same time, it will also get posted to the patient portal, but knowing that people probably aren't sitting there with that portal up on their phone all the time, they will also get an email and or a text with a link that they can click. They can enter their date of birth as a secondary identifier, and their result report will come up right on their device or computer or whatever it is that they're using to access it. So we're proactive in terms of how we report results to the patients because we don't want them necessarily having to contact you to find out what's going on. So that's kind of how patient information works. Quite honestly, more often than not, when folks are using that patient portal to do it, your interaction time with the patient is probably 1 minute. It's again, providing with a QR code and just kind of telling them briefly what to do and giving them some space to do it. So once they've done that and they've got themselves registered in our system, we need them to collect their sample. This is a nasal swab, what's called an anterior nares nasal swab. It's not a brain swab. It's not a throat swab. It's not anything that should be uncomfortable. And because of that, it's intended for the patients to self-collect their samples. Each collection kit comes with a swab, comes with a tube that the swab with the collected sample will go into. It also comes with what's called a biohazard bag that the collected sample that's inside that collection tube goes into. And it also has a sleeve on the outside where we can get copies of any paperwork that comes in, whether that's a paper requisition form or if a patient is not able to use our patient app to upload copies or images of their health insurance cards, we're going to ask you guys to make photocopies of them and include those with their samples. Really, really simple process. Again, it's the swab itself is going about a ½ inch into each nostril. It's not something, again, that should be uncomfortable. Takes about 20 seconds total for the patient to do that. They're going to put their sample in the collection tube. There's a couple of things they need to do to label that sample. They're going to put it in that biohazard bag and they're going to bring it back to you. And all we ask you to do is provide them with the kit. We have printed instructions that you can either post or hand to the patient so they can go do this on their own. But then also verify when that patient comes back. Did they label their sample correctly? Do they have any questions? Are we going to receive the appropriate supporting information? Again, if photocopies had to be made of insurance cards, things like that. Very, very simple process. Again, really short interaction time with the patient. I think for pharmacies that kind of have it quote unquote figured out how it works best in their workflow and patients are using that patient facing portal to register, your total interaction time is 2 to 3 minutes. And so that $20 collection fee, quite a bit of that goes to your bottom line, which is ultimately what we all want. So that's kind of sample collection in a nutshell. I told you before that we email and text results to the patient. We also post it to your provider portal for those that can't or haven't, for whatever reason, received it on their device. Simple to read reports that have some very basic information about the test itself and when we received, or the sample was collected, when we received it, and when we ultimately reported the result, with a pretty easy to read table down below that lists each of the 4 pathogens that we're looking for and the individual results for each. So you, again, the patient and their other healthcare providers can use this pretty simply to figure out what the appropriate next steps are. So once any samples have been collected, we got to get them from you to us. So we use UPS. UPS has a dedicated program for laboratory. It's actually human specimen laboratory samples that we use. It's important from our perspective that they have that, because they basically prioritize shipments that come in this packaging over others when there are issues, whether they're weather created or otherwise. When it comes time to, having to prioritize what goes and what doesn't, this program and this packaging that we use moves what we're doing from the top, because they understand, of course, that time is of the essence when you're talking about something like this. So when you enroll with us, we get UPS to send you those shipping materials that you need. They'll send you a stack of boxes. We also provide you with login credentials to our ups.com account. Where anytime you have something to send us, you can jump on there, and in about 2 mouse clicks, because everything will be preloaded for you, you can create and print a label that will go on that box. And then there's also a program that we will get you hooked up with where it's a really easy to use protocol to get UPS in there at the end of the day to pick up your packages from you and get them to us, so that you're not being asked or forced to drop them off somewhere. We want this to be non-disruptive to your typical workflow. And so again, I covered this before, that everything comes to us next day air. We receive samples Monday through Saturday by about 10:30, and then we get results reported. We state here by the end of the day. The reality is it's by mid-afternoon.